Hi, my name is Noah Nethert. We're going to do a cranial nerve exam 1 through 12 today. It's October the 18th, 2018. Please scan the room. All right, patient, if I can have you cover one nostril. Inhale. Good, just like that. Other side. For obstruction, good. Now close your eyes. Do the same thing. Cover one nostril. And inhale. Good. And other side. Good. What's the smell?
Copy.
Is the intensity of the smell the same on both sides?
Yes, sir.
Great. Moving into fundoscopic exam. Now, when we do this exam, I'll be shining light in your eyes, okay? And some tests later, I'll let you know. We'll do the same thing. Okay, so look over my left shoulder, please. Good. There we go. We're looking at arteries, optic cup and disc, things like that, following into the retina. Good. Looking for abnormalities such as AV nicking, papilledema, and glaucoma, which is a large cup-to-disc ratio. Please look over my right shoulder. Great. Ooh, sometimes I'll still get that off a little bit. Good. All right. Now then, we'll go ahead and get into our peripheral field. So, cover one eye for me, just like this. Don't smush your eye, please. I'm going to wiggle my fingers like this. Let me know when you can see them, okay? Look straight ahead at the wall. Pick a spot, all right?
No. No. No.
Keep that eye covered.
No. No. No.
Good. Cover the other eye for me. Let that one adjust for a second. All right. Same thing. Keep looking straight ahead.
No. No. No.
Good. Keep that eye covered for me. Thank you. That's all right.
No.
Sorry about that. Let me do that one again.
No.
Good. Okay.
No.
All right.
No.
Perfect. All right. You can put that down. Now I'm going to check for some pupillary light reflex and swinging light reflex. So, look right here at my chest or straight ahead is fine. Look for direct on the left eye here, direct constriction. Concentrical of the right eye, switching eyes. Direct of the right eye, concentrical of the left. Now if I happen to shine the light in one eye and neither eye constricted, and I shine the light in the other eye and both reflexes were normal, I'd know that the eye that I shine the light in the first time, say it's his right eye, if I shine in his right eye and nothing happened on either eye, I know I've got an optic nerve lesion on that side. And I shine the light into the right eye, and the right eye constricted, but the left eye concentrical was not there, constriction. And if I shine into the left eye, the left direct wasn't there, but the right concentrical was, I know I've got an oculomotor lesion on the left eye. All right, I'm gonna hold on to this for later. Please look at me straight ahead. Looking for ptosis here. Oh, let me back up real quick. Mark's gun people, that's what we're looking for here. We do the swinging light reflex. There we go, looking for constriction. Should be normal and equal on both sides. One will constrict consistently less than the other one. We've got a Marcus gun people. Okay, now then, moving on to our ptosis, looking at the patient's eyelids. Close your eyes for me, blepharospasm check. Open them for me. Now we're going to do convergence and accommodation. So look right here at the tip of this pin, okay, right there. And follow it in. Good, looking for constriction of the pupils. Now look at a spot on the wall out there for me. Look for accommodation here. Okay, now look at the pin. Look at the wall, the pin, look at the wall, back at the pin, great. And now I'm looking at the right eye, that was the left eye. Look at the wall for me, look at my pin, look at the wall, look at the pin, look at the wall, look at the pin, great. Okay? Now then, moving on to our H and X in space. Look at the tip of my finger right here and follow it as I move, okay? So what we should see here is normal tracking. And when we pause, we're looking for end-stage nystagmus, which would be an abnormality. Good, keep following without moving your head. What we don't want to see here are fatigue, paralysis, and saccades. Keep following that finger for me. Good. All right. Keep following. We're getting there. Now then, moving on to trigeminal nerve. Put your hands on your lap for me and close your eyes. Can you feel that?
Yes.
Great, we're going to do that on your head now. Keep your eyes closed. Can you feel that?
Yes.
Was the intensity same throughout the motion?
Yes.
Can you feel that?
Yes.
Was it the same throughout?
Yes.
Was it the same on both sides, intensity-wise?
Yes.
Great. Can you feel that?
Yes.
Was the intensity the same throughout?
Yes.
Feel that?
Yes.
Was the intensity the same throughout?
Yes.
Was it the same on both sides,
Yes.
intensity-wise? Good. Can you feel that?
Yes.
Was the intensity same throughout?
Yes.
Can you feel that?
Yes.
Intensity same throughout?
Yes, sir.
Intensity same on both sides?
Yes, sir.
Great. Keep your eyes closed for me. Can you feel that?
Yes.
Okay. Can you feel that?
Yes.
Intensity same throughout?
Yes, sir.
Feel that?
Yes.
Intensity same throughout?
Yes.
Intensity same on both sides?
Yes.
Can you feel that?
Yes.
Intensity same throughout?
Yes.
Can you feel that?
Yes.
Intensity same throughout?
Yes.
Same on both sides?
Yes.
Can you feel that?
Yes.
Intensity same throughout?
Yes.
Can you feel that?
Yes.
Intensity same throughout?
Yes.
Same on both sides?
Yes, sir.
Great. You can open your eyes now if you'd like. Good. Now clench your jaws. Feeling for muscle tone of the muscle mastication, the masters and temporals. Open your jaw into my hand. Looking for depression, muscle strength, and muscles mastication again. Now relax your jaw to where it just barely hangs open, but don't force it. Relax. Looking for jaw jerk reflex there. Excuse me, there. Now go ahead and look right here. Scrunch your forehead, lift those eyebrows. Good. Close your eyes real tight and let me open. Perfect. Puff your cheeks out. Good. Big smile for me. What's the funniest thing you heard today? That's funny, right? Okay. Now, can you hear this?
Yes.
Let me know when you cannot hear it.
No.
Okay? Can you hear this?
Yes.
Let me know when you cannot hear it.
No.
Okay? That's to just check for localized, maybe conduction hearing loss. This is Weber's test. What side does the sound lateralize to?
All right.
Right ear. Okay? So now that's Renee. Now we're going to do Renee's test. Can you hear that?
Yes.
Let me know when you can no longer hear it.
No.
Can you hear this?
Yes.
Okay? So, if the air conduction, if the bone conduction and the air conduction are both present and the sound, the ear of the sound lateralized to, the patient's got sensory neural loss in the opposite ear, contralateral ear. If the sound of bone conduction is present but air conduction sound is not, the patient has an ipsilateral conduction loss. Now while we're here, we're going to look for resting nystagmus, and none is apparent, so that's good. Okay, now we're going to have the patient hop up. What I'm going to have you do is look straight against the wall, and you're going to walk heel-toe for me, okay? Go ahead. Straight at the wall. I'm here to catch you if you need me. Good, now turn around. This time do it with your eyes closed, looking straight ahead. Do not look down even with your eyes closed. Good, I got you in case you fall like that. It's okay. Good, don't take your time, don't rush. All right, now go ahead and sit down. Alrighty, now then, open your mouth for me, sir. Good. Checking for atrophy and fasciculations of the tongue. That would indicate where a lesion might be if cranial nerve 12. Push your tongue against the sides of your mouth for me. Yep, good and good. If there's weakness when pushing on his right side of his cheek, that means there's a left-sided lesion at cranial nerve 12. Stick that tongue out for me. Good, all the way. Looking for fasciculation, loss of tone, and deviation. If the tongue deviates to one side, the lesion is on that side. So if the tongue deviates to the right, you have to get a right side of cranial nerve 12 lesion. All right, moving on to gag reflex, cranial nerve 9. Open your mouth for me. Good. Check the right side. Good. Sorry about that. I know it's not fun. And left side, gag reflex is present. Open your mouth big and wide. Say ah. Good. We're looking for retraction of the levator palatine muscles. If there's not retraction on one side, then there will be a lesion on that side. Uvula will deviate away from the lesion. Now do that except 5 times, short and choppy. Ah, 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 ah. There we go. Looking for a physiological lesion that would tell us there's fatigue going on. And then shrug your shoulders. Don't push down. Turn to that hand. Good. And my right hand. Good. If you turn it to my right hand, there'll be left SCM activation and vice versa. Please scan the room.